This meeting is now being recorded.
Good afternoon, ladies and gentlemen, and welcome to my presentation titled Modification of Self-Concept in Patients with an LVAD, an Initial Exploration. There are 6 million Americans diagnosed with heart failure in the United States. Due to the chronic and progressive nature of heart failure, more than 100,000 patients with advanced heart failure will experience progressive symptoms such as marked shortness of breath, which is unresponsive to maximum medical management. Because of the limited availability of donor organs and an increasing prevalence of heart failure risk factors, such as hypertension, mechanical circulatory support with a left ventricular assist device is becoming a therapy of choice for patients with advanced heart failure. A left ventricular assist device, or LVAD, can be used for patients waiting for a transplant, or called a bridge to transplant, or as a permanent alternative to transplant or destination therapy, or even as a bridge to recovery in cases of myocardial infection and used to rest and recover the heart. In these situations, LVADs have been known to sustain life and improve patient quality of life. However, it may cause major psychosocial issues for patients. For example, patients with LVADs are attached to internal and external components which can cause psychological distress and potentially alter perceptions of self-concept, such as mental images about their self in relation to the body. Thus, patients may have difficulty in modifying self-concept, which can affect their ability to carry out their required self-care of the LVAD system, affect ego integrity, and also affect their willingness to engage in social relationships. The ability to modify self-concept, therefore, is vital for promoting and maintaining emotional integrity, continued adherence to LVAD, and the development and continuation of social relationships which will enhance overall quality of life. Although few studies have identified threats to self-concept, to date, no published studies were found that investigated how patients with LVADs modify their self-concept. The current study seeks to address this gap in knowledge and uses a theory of self-care as a framework to guide this study. Within the theory of self-care as described by Oram, patients are viewed as self-care agents capable of making conscious choices regarding the self-care to be performed. According to Oram, self-care refers to the actions people take to meet self-care requisites required to maintain structural and functional integrity. There are 3 types of requisites that persons must meet for optimum health: universal, developmental, and health deviation. Universal requisites are basic needs fundamental to everyone, such as the need for air, water, and food. Developmental requisites are related to needs to sustain human development. And health deviation requisites are additional requirements that must be met due to pathology and medical management. Oram addressed the importance of self-concept in meeting one's self-care demands in the HDSCR of self-concept. In the current study, we focused on the reformulated LVAD-specific HDSCR that relates to self-concept, which is modify self-concept by accepting oneself as being in need of technology-assisted living in order to attain self-acceptance sufficient for continuous engagement in therapeutic LVAD self-care. And 2, to modify self-image to preserve ego integrity and psychosocial sexual relationships while living with an LVAD. Modifying self-concept, therefore, is necessary for patients to carry out the self-management aspects of LVAD care, as well as crucial for achieving psychosocial and social well-being, all of which contribute to their overall quality of life. Thus, the purpose of this study was to explore how patients with LVADs meet the health deviation self-care requisite of modifying self-concept and self-image to accept this form of treatment and determining what they need to do to restore normalcy. Two research questions for the study were, what is the experience and meaning of living with an implantable LVAD? And what are the personal, social, and intimate experiences of LVAD patients? A hermeneutic phenomenological study based on the methods of Van Menen was utilized to explore and understand self-concept among patients with LVADs. This method consists of both empirical and reflective activities in order to elicit the meaning of the lived experience. A purposive, convenient sample of 7 men and 2 women, 31 to 70 years old, were recruited from a single mechanical circulatory support program in the Midwest. The majority of participants were married Caucasian men. Prior to data collection and beyond, I used 2 bracketing procedures to remain open to participants' voices. First, I maintained a reflective journal to openly disclose any personal perceptions, assumptions, and biases about living with an LVAD. Second, I engaged in ongoing discussions with other members of the research team. After obtaining IRB approval, data was obtained through tape-recorded, face-to-face, semi-structured interviews. Participant interviews commenced with the following questions. Tell me how living with the LVAD has affected your perception of your self-concept, self-image, and what strategies helped you accept this new image? Probing questions such as, what do you mean by that? Can you tell me more about that experience? Were used to elicit descriptions of the data. Field notes and a demographic profile were completed as well. Interviews lasted 15 to 120 minutes, were transcribed by a trained transcriptionist, and verified by me for accuracy. All transcriptions and field notes were read and reread several times prior to engaging in further interviews. Data collection stopped after responses with 9 participants became redundant. The holistic, selective, and detailed approach described by Van Menen guided thematic analysis. Each transcription was initially examined as a whole, then line by line. Then we engaged in a more focused reflection. Words, phrases, and emerging themes were identified. Data that was then organized, encoded into words and phrases using the qualitative software NVivo 8. The culmination of these 3 approaches produced clustered topics, which were reduced into themes that illustrated the essence of modifying self-concept and self-image while living with the LVAD. Final themes were consensually validated by all members of the research team. 2 main themes were constructed from the data. 1, having an LVAD means living, and 2, a desire to be normal in public. Theme 1, having an LVAD means living. As participants reflected upon their new lives with the LVAD, it appeared that they accepted their new self-concept as living with this life-sustaining device. Responses such as, didn't affect self-image, and life is living with the LVAD were reported unanimously across all participants. Female participant richly described the perception of her new self-concept with the LVAD. I looked at the LVAD and I think, I've got to do this the rest of my life. I realize I have the rest of my life to live now and I didn't before. I thought I would really feel strange and want to avoid looking at myself in mirrors, but I realized, saved my life, you know? I'm alive to look in the mirror. It seemed that the majority of participants readily modified their self-concept and accepted that they needed this life-sustaining device. They felt it was easy to adjust to their new life with the LVAD. Comments such as, easy to get used to, not as bad as I thought it was going to be, echo throughout participants' texts and richly described by a male participant. Once I had it on, you kind of experiment with it. So yeah, I can do this, or yeah, I can do that, and it's not as terrible as I thought it was going to be. While participants described that adjusting to taking care of the LVAD within the privacy of one's own home was easy, venturing out in public with the LVAD was a different experience for the majority of them. Theme 2, a desire to be normal in public. Participants were also aware that being seen with the LVAD in public drew attention to them, so they were mindful to conceal the outer components of the LVAD to prevent unnecessary public scrutiny, as described by a male participant. I sometimes will wear a different type of jacket so I don't upset people too much, because people get shocked when they see someone with wires sticking out all over them. As participants reflected upon their new lives with the LVAD, it appeared that they accepted their new self-image as living with this life-sustaining device. Despite participants' awareness of ongoing public scrutiny, it was apparent that they unanimously accepted the inherent curious nature of the public eye and continued to engage in activities of daily living, including recreational activities, and continued to flourish in both personal and social relationships. To determine methodological rigor and enhance objectivity, steps to determine trustworthiness were incorporated throughout the study. For example, prolonged engagement, period of briefing, and member checks were used to ensure credibility. We have facilitated transferability by utilizing a purposive sample, providing details regarding our research, and presenting thick descriptions of our procedures, findings, underlying assumptions. To address dependability and confirmability, an audit trail was maintained by me, and an inquiry audit was performed by a member of the research team with extensive qualitative expertise. Validation of research findings was confirmed by a thorough examination of the research process, methods, procedures, findings, and implications. There were some limitations in the study, including that participants were comprised mainly of Caucasian men recruited from a single site, thereby limiting generalizability to other LVAD recipients. Also, participants in our study did not specifically describe self-care actions geared towards developing and maintaining a realistic self-concept as described by Orem. Self-care actions used by participants to modify self-concept and self-image require further investigation. Our study illustrates a preliminary view into the inside perspective of the phenomena of modifying self-concept and self-image among patients with LVAD. Participants accepted the LVAD as necessary to live and so were able to modify their self-concept. Yet, attaining a sense of normalcy was more difficult in public settings and required additional lifestyle modifications. More research is needed to validate the findings and address study limitations. For example, research utilizing larger sample sizes and diverse population self-care actions used to modify self-concept and self-image. Other components of the theory of self-care, like the basic conditioning factors, can be used to identify which socio-demographic variables, such as age, gender, and sociocultural aspects, are predictive of an LVAD recipient's ability to engage in self-care actions necessary to modify self-concept. Study findings also advance self-care knowledge in LVAD patient management and can heighten nurses' awareness about self-concept and self-image as vital components for maintenance of health and well-being among recipients of LVAD. Since utilization of LVAD is on the rise, future research is warranted to guide interventions and evidence-based guidelines aimed at developing clinical practice protocol to improve quality of life of patients with LVADs. Thank you for viewing my presentation.